Coming up on Network Africa. South Africa calls up army reserves to halt unrest as businesses count the cost of looting and violence. Troops across Ethiopia reportedly mobilizing to fight Tigray rebels. Plus, COVID-19 deaths in Africa surged more than 40% over previous week. Hello and a warm welcome to the program. I'm Teniola Shubowale. The military forces in South Africa have called up all members of the Army Reserve and ordered them to report to their units amid the ongoing unrest in the country. It comes as the government announced an increase in its deployment of troops to 25,000, 10 times more than originally proposed, to help quell the violence. At least 72 people have died and more than 1,700 have been arrested in South Africa's worst unrest in years. Meanwhile, as cleanup operations in some parts of Gauteng and KwaZulu-Natal provinces have begun after recent lootings in the past week, many businesses are counting their losses. Hundreds of businesses, including shopping malls and petrol stations, were attacked and looted, some burnt. The damage is already estimated at 15 billion rand and counting.
Calm is slowly returning to Soweto in Johannesburg, where various malls and businesses were looted and vandalized in the past week. Cleanup operations have begun here in Soweto Diepkloof. As you can see behind me, community members rallying to clean up what they call their mall. It's a much better site than what it was a couple of days ago when we visited the area. This is one of the malls which was looted and ransacked by looters in the unrest which we've seen in the past couple of days. Several government officials have been deployed to the affected areas to help. At the Diepkloof Center, we had the Minister of Forestry and Fisheries, Barbara Chrissy.
We can only join those who have condemned the wanton violence and destruction that has destroyed malls and infrastructure both here in Gauteng and also in KZN. But I think we do have to take this opportunity to salute our citizens and community members who have come out over the last couple of days, first of all, to defend these institutions, but secondly and most importantly, to lead the cleanup campaign.
The cleaning has started, I think, about 2 days ago. The response is overwhelming to an extent that we even turn other people back because we don't want to have a huge group.
While some malls still look a mess, some, like the Maponya Mall, were spared, shielded from looters, first by community volunteers and now the security agencies. Damage to property is estimated at 15 billion rand, and the impact of these violent actions will affect other supply chains as food and fuel shortages have been forecast. With many businesses being damaged, this will also affect the unemployment market, with the country's unemployment rate already at an all-time high of 32.6%.
Shop owners might not renew their leases because of now. They're not sure if they are safe. Because each and every one has lost millions.
There will be no doubt that a lot of small businesses have lost their employment for good. And they, not only the business owners, but the employees working for them are also likely to have lost their jobs. And unfortunately, it's mainly your small black-owned entrepreneurial businesses that have been opening up in little townships, in little shopping centers, who've been completely wiped out.
Though some parts of the country are peaceful, there are still sporadic attacks in some areas, especially in KwaZulu-Natal, where buildings are still being torched, and the violence now has some racial colorations in some instances. Government's immediate plan is to ensure peace returns to the whole country so as to achieve its long-term goals to rebuild and to get the road to economic recovery back on track. From Johannesburg, South Africa, Brian Pogeni, Channels Television News.
Well, our South Africa Bureau Chief, Betty Dibia, joins us from Soweto, where she's been speaking to some of the young people in the community about the happenings of the past few days. Betty.
Thank you, Tenny. We visited some of the shopping centers that have been vandalized, not just shopping centers. There were also petrol stations that were affected in the violence and the looting. And we came here to Maponya Mall, like some of those other places we visited, where the community members came out in their numbers, as you can see behind me, to help in the cleanup operations of the affected malls. And here, in one of the malls, we met one of the ministers, that's the Minister for Fisheries and Forestry, Ms. Barbara Creasy, who told us how the government feels and how the reason why she came to be part of those who are cleaning up the communities or the affected areas. And here at the Jabulani Mall, also in Soweto, because we're here in Soweto, we had a conversation with some of the young members of the community who also came to be part of the cleanup exercise, volunteering to clean up. We know that recovery of the businesses will take a long effort and a long time to be achieved, but they're here to just help clean up all the mess that has been made by all the looting that went on for a couple of days in this area. What was it like? Were you part of the...
Oh, was that? No, it was very horrific, very horrific. And we have lost many things inside. We can't even buy bread. It's just terrible.
Yeah, apart from the fact that we can't get bread, people lost jobs. Yeah, there will be so much cut off because now they have to repair the things that people abas moshil, so it's bad. It's really bad.
Are you seeing people in the community bringing out things that they stole?
Yes, we are seeing them.
We are seeing them, but we can't just take them out. It will be war. They will kill us.
So what would you want government to do?
I would like the president to not cut out the 350. He must increase the SASSA money, and also he must job opportunities must also rise because it has decreased. Yeah, maybe people wouldn't have done this. Yeah, maybe people wouldn't have.
But you know government is struggling. The corona hasn't helped. Over a year.
Yeah, we know, but it wasn't our fault.
The thing is, yes, the president, ne? But at the end of the day, as you can see, people are frustrated. Ne? We are all frustrated at the end of the day. We didn't condone this thing. We didn't say it's an excuse to do this thing. Ne? But then at the end of the day, truth be told, we are frustrated as people. As young people, we are frustrated.
I personally think this was the outbreak of the extent of lockdown. Because if Ramaphosa didn't continue with the lockdown, maybe things would be different. And if they could free up Zuma, and then maybe this thing was going to be more calmer.
But you know, you can't bully the law regarding Zuma. And then the lockdown, there's a reason why he increased it. Numbers were going up.
It's pointless because the numbers are rising and yet we are on lockdown. We are on lockdown, but the numbers are still rising. We want to see the difference. We want to see the difference of the lockdown. If it's working, then the numbers must go down. What is the point of the lockdown? So it's giving us frustrations. It's giving us people, like everyone is frustrated. But I'm not saying it's a good thing that they did all of this, but at the same time, I'm just trying to balance the scale.
South Africa Bureau Chief Betty Dibia speaking to some young people in the community helping to clean up after the unrest in South Africa. Well, to Ethiopia's Tigray crisis now, growing numbers of troops are reported to be mobilizing across the country to join the fight against Tigrayan rebels in the north of the country. This could signal that the conflict might be taking a new shape with the involvement of forces from the other regions. Local media say forces are rallying from the Oromia, Sidama and Southern nations, nationalities and peoples regions. It comes amid calls by Prime Minister Abiy Ahmed for the public to show support for the army and the government. On Wednesday, the authorities in Amara, which borders Tigray, announced an offensive calling up retired soldiers and local militias. Just last week, UN officials said the fighting in Tigray had already resulted in a famine that was affecting more than 400,000 people.
And called Abi's statement.
Well, let's check in on the COVID-19 situation now. Africa has recorded a 40% rise in COVID-19 deaths this week compared with last week, as infections and hospital admissions have jumped and countries face shortages of oxygen and intensive care beds. The World Health Organization says Africa's case fatality rate, the proportion of deaths among confirmed cases, currently stands at 2.6% against the global average of 2.2%. The surge has been driven by public fatigue, with key health measures aimed at curbing the spread and an increased spread of virus variant. WHO says Africa has seen one of the world's fastest surge in cases, with an additional 1 million over the past month.
As this surge sweeps across Africa, we're witnessing the brutal cost in lives lost. Deaths have climbed steeply for the past 5 weeks, jumping 40% in the past week. This is a clear warning. Our hospitals are at a breaking point. In all, 153,000 people have sadly died. This COVID-19 resurgence is the fastest the continent has seen. New cases have increased for the 8th consecutive week, and 18 African countries are now in resurgence.
Well, in East Africa, the Rwandan government has announced a 10-day lockdown in the capital, Kigali, and 8 other districts amid a rising number of COVID-19 cases and deaths. People have been ordered not to leave their homes from Saturday, the 17th of July, until Monday, the 26th of July, to try to halt the virus spread. Businesses, the civil service, transport, schools, sports, and the entertainment sector will all close, and only 15 people will be allowed to attend funerals. People will only be allowed to step out of their houses for essential services or if they are essential workers. The last 4 weeks have seen record numbers of cases, with nearly 1,000 per day, and the last 7 days being the deadliest. Health officials say the fast-spreading and deadlier Delta variant is behind the spike. Rwanda has recorded more than 50,000 COVID-19 cases and over 600 deaths. More than 400,000 people have been vaccinated. Well, after successfully containing the initial wave of the COVID-19 pandemic last year, Tunisia is now also struggling to cope with a resurgence of the virus. Officials say intensive care wards are full and doctors are overburdened by a rapid rise in cases and deaths.
In Charles Nicolle Hospital in the Tunisian capital, the emergency department is filled with patients who are sharing oxygen in rooms and even hallways. Intensive care wards are packed and doctors overburdened by a rapid rise in cases and deaths in the country.
The medical and paramedical staff are in a state of complete psychological collapse. The mortuary has become full. Just the other day, we had a deceased person since 5 a.m. and we did not find a place for him. So we put the dead person in a room in the emergency department.
Tunisia has recorded 157 coronavirus deaths on Tuesday, the highest daily tally since the start of the pandemic. In all, it has reported around 17,000 deaths and 500,000 coronavirus infections.
We are suffering. We urgently need oxygen. The demand has exceeded the stocks that we have.
Officials fear that the already weak healthcare system will collapse under the strain, which has prompted the president to appeal for help from the international community. That distress call is now being answered. Arab countries promised help earlier this month. A Qatari field hospital has already arrived, and this week planes from Egypt, Algeria, UAE and Turkey touched down, loaded with urgent medical aid and vaccines. Saudi Arabia pledged to send 1 million doses of vaccine and important medical aid, while Morocco promises to send 100 intensive care beds. France said it will send medical aid and about 1 million doses of vaccines to its former colony, while the United States has also pledged 500,000 doses of the vaccine. For many, the help cannot come soon enough.
My mother is in the hospital. Her doctor told me that she's in a critical condition. The medical staff is doing its duty, but the lack of oxygen is the problem. People die every day from the lack of oxygen.
The latest aid brings to more than 3.3 million the number of vaccine doses donated to Tunisia, where vaccinations lag far behind many countries. So far, only 750,000 people have been fully vaccinated out of a total of 11.6 million residents.
Still to come on the program. Amnesty International slams Libya and Europe over horrific abuse of migrants. More details in a moment. Please stay with us. Thanks for staying with us. The head of the World Health Organization's Essential Program on Immunization, Dr. Anne Lindstrand, says the COVID-19 pandemic has set the world back a decade when it comes to the progress reached by childhood immunization. According to official data published by WHO and UNICEF, 23 million children missed out on basic vaccines through routine immunization services in 2020, 3.7 million more than in 2019.
Vaccines are one of the most powerful tools we have in public health. And with the backsliding we see today, we have an imminent risk of outbreaks happening, measles outbreaks, polio outbreaks. And it's really important now to catch up, recover, try to reach those children being lost during the pandemic year. Otherwise, we'll trade just one crisis for another. And it's the children who are paying the silent price of this pandemic. What is needed now is for all countries to look at their immunization services, to restore the immunization, to catch up those children that were lost, those that were not reached by immunization during this pandemic year, and catch them up and give them and offer them the vaccines that are needed. We need to communicate with communities when it comes to coming back to the immunization services, understanding the full value of these vaccines. Unless we act now, we are going to have many outbreaks. We're going to have to deal with the consequences of not having reached these children with life-saving immunization. We'll have many children die and being sick from measles, from polio, and from other diseases. So we need to act right now, not just to restore immunization programs to be able to deliver the COVID-19 vaccines, but also for the life-saving childhood immunizations.
Away from the COVID-19 pandemic, back here in Nigeria, the Yobe State government and World Health Organization have flagged off the second round of 2021 seasonal chemo prevention, targeting over 3.6 million children to reduce the cases of malaria. At the event in Damaturu, the state capital, the Commissioner for Health, Dr. Lawangana, revealed that malaria has become the #1 killer disease in the state, which, if not properly addressed, can become an epidemic.
According to the World Malaria Report 2020, there were 229 million cases of malaria, with an estimated 409,000 deaths in 2019 worldwide. 6 countries in Africa account for over half of the malaria deaths in the world, with Nigeria having the highest of 23%, as reported in 2019. Further investigation reveals children under the age of 5 are the most vulnerable and are more likely to die from the disease.
It was not only the #1 killer during the past 9 months, but one can predict with great certainty that it is going to be the main cause of disease and death over the coming months as malaria transmission picks up, unless something drastic is done.
While the Yobe state government says it's targeting children and pregnant women, the World Health Organization has expressed readiness to support the government in eliminating the disease.
Malaria is an endemic disease in tropical regions and accounts for about 90% of the total and the tropical Africa accounts for about 90% of total malaria burden in the world, particularly among pregnant women and under 5 children.
The government and partners in Nigeria have deployed an enormous amount of human, material, and financial resources, but malaria has remained a huge public health problem.
No doubt the provision of chemo prevention will help in reducing the mortality of children under 5, but keeping the environment clean against the malaria breeding ground is key.
And our rights group Amnesty International has condemned what it calls the complicity of European states in horrific abuses suffered by migrants intercepted at sea and forcibly returned to Libya. A report by the group suggests that conditions in Libyan detention centres are worsening and migrants are subjected to torture, forced labour, sexual violence and extortion. Amnesty urged EU countries to suspend cooperation on migration and border control with Libya. United Nations figures say the Libyan Coast Guard returned more than 13,000 people to Libya in the first 6 months of this year. On July the 9th, South Sudan marked a decade of independence. On this significant occasion, the United Nations mission in South Sudan spoke to citizens from Bentiu Unity State about the hope that independence brought, the devastation wrought by civil wars, and their continued optimism for a peaceful, prosperous future for all communities across the young nation.
9th July 2011 was a day to remember for South Sudan. After a hard-fought struggle, it declared independence from its northern neighbor, Sudan. This month, the world's youngest country celebrates 10 years since that pivotal moment in history.
Independence of our country is important for me as an individual because it gives me a new identity as a person, because South Sudanese identity is a new thing. We used to be called Sudanese people, but now I am a South Sudanese citizen. So in this regard, it gives me a new identity, as a person, and it also gives me a new hope.
This hope, however, was shattered as subsequent civil wars left unimaginable death, destruction, and massive displacement in their wake. Today, with a peace deal and a transitional government of national unity, political violence has reduced. The process of writing a permanent constitution has started, and South Sudan is looking forward to free, fair elections.
To me, it's also important that we have a nation, we have political stabilities in which we can govern ourselves. We also have economic stabilities in which we can develop our country. And likewise, we are having a president where there is executive, judiciary, legislative, that qualifies that we are a nation. And we are proud of that country, South Sudan. It has taken us a long journey since we were struggling for that. A number of people have lost their life because of this nation, and we are happy to be as a South Sudanese.
There's renewed optimism and vigor among citizens and authorities alike that the world's newest country will live up to its dream, where all communities are included in decision-making and have a say in the issues that impact them directly, so that future generations can enjoy a durable peace.
Independence of our country open new chapter. It actually gives me an opportunity as a person so that I can participate in the affairs of the country that we think will shape the future of our children. So in this case, the independence of South Sudan is generally important for us because we believe with a new country, there will come a lot of opportunities that we will enjoy as citizens. There will come a lot of opportunities that we feel will be enjoyed by our grandchildren.
Many of the oil-rich nations, 11 million people, have spent much of the last decade surviving civil war. In his Independence Day speech, President Salva Kiir vowed not to return the country back to war again. It's a promise many South Sudanese hope will be kept.
And that's the program today. Thank you so much for watching. I'm Tenyo Lashaboale. Bye for now.